My name is John Lent. I'm the Executive Director of the American Friends of the Episcopal Diocese of Jerusalem. And I am delighted that you can join us for this conversation with Suhaila Tarazi, the Director General of Ahli Arab Hospital in Gaza. And to begin, I want to thank all of you for your support of Suhaila's work in Gaza. You are all generous and faithful supporters, and I'm deeply grateful, as is Suhaila. It is my great pleasure to introduce Suhaila Tarazi. Suhaila was born in Gaza. She went to elementary and secondary school in Gaza public schools. She obtained her bachelor's degree in Egypt and her master's in healthcare administration at Leeds University in the UK. And Suhaila worked in Libya and Egypt, England, and the United States before joining Ahli Hospital more than 30 years ago. And she always felt attached to Gaza and its people, especially the poor in Gaza. And she was drawn to Ahli's mission of healing. As you know, I think all of you know, the living conditions in Gaza for most Gazans are appalling. There are 2.1 million people living in a tiny strip of land, 25 miles long, 4 to 5 miles wide. Gaza's closed off from the world by concrete walls, by razor wire gun towers, and a sea blockade. No one enters or leaves without permission of Israel. And with the economic crisis, the unemployment rate in Gaza is now above 50%. 80% of Gazans receive food aid. And Gazans live under the constant threat of violence. It may not always make the headlines, but violence and conflict are a reality of everyday life in Gaza. Ahli Hospital is the oldest hospital in Gaza and the only Christian hospital. It's the only hospital in Gaza not run by a political faction. Ahli receives no financial support from the government, either Hamas or the Palestinian Authority. And Ahli serves everyone, mostly families from nearby refugee camps in the poorest neighborhoods in Gaza City. And no one is turned away. Twice a week, Ahli runs a free community clinic, which would truly not be possible with your support. People seek out Ahli because, one, they know they'll receive excellent care, but just as important, they know they'll be treated with dignity and respect. Suhaila is a Palestinian Christian. She's one of fewer than 1,000 Christians left in Gaza. Her service to the needy in Gaza is a genuine sacrifice. Suhaila does not have to live in Gaza. She has dual citizenship and she could leave if she chose to, but she stays in Gaza. She stays because she feels God's call to serve the poor and the vulnerable. It's truly one of the great privileges of my work to be a friend of Suhaila's and to visit Ahli Hospital regularly before the pandemic. And when I visit, I always walk the quarter mile between the Erez border crossing and the first Palestinian checkpoint. When I get to the checkpoint, it's crowded and chaotic. I have no Arabic. So I simply say to the first person I encounter, Ahli Hospital. He puts his hand over his heart. He takes my hand and he leads me to the van where Suhaila and a driver wait. Hand over heart again, he thanks Suhaila. Everybody in Gaza knows Suhaila and everyone respects Suhaila. And I'm delighted that you'll get to know Suhaila a bit today yourselves. So thank you all for joining us. And welcome Suhaila from Gaza. She's in her office today at the hospital. So she was worried about not having electricity. One of the challenges of life in Gaza is that the power grid is intermittent, but the hospital does have generators. So she guarantees me that she's going to have power throughout the whole conversation. Suhaila, welcome. And I'd love to ask you just to start by telling us how Ahli Hospital is different from other hospitals in Gaza and why it's so important that people have the option of Ahli Hospital for their care.
First of all, thank you for inviting me to attend this meeting and to see all my friends and the partner of Ahli Arab Hospital in our mission of healing. It's of my great pleasure to be with you on Zoom today. And thank you for your time and for your efforts to support Ahli Arab Hospital in Gaza. Ahli Arab Hospital, as a Christian hospital, follows the step of our Jesus Christ, where we have to love one another, to love our neighbors. Ahli Mission of Healing built on these values. People of Gaza, they prefer to come to Ahli Arab Hospital because they are sure that this hospital is theirs. They are meeting with a loving staff, with a big smile. And they are treated with the best doctors in the Gaza Strip. Poor, they have no chance to go to specialized doctors. It is beyond their ability to pay the fees of the doctor. Ahli Arab Hospital opened its door wide for them to come and to have the best care ever. Ahli Arab Hospital services provided without any discrimination of faith, gender, political affiliation, or social class. We believe that we are all creatures of one God, and the services should be accessible and affordable to all who are in need. As you have mentioned, John, poverty rate in Gaza is more than 70% of population. Today, more than 90% of the population are living on some sort of aid from here and there. And it is beyond the capability of a sick patient to go to have quality of health care. In particular, most of the people are not covered by any health insurance in Gaza. I recall a story when a lady, Gaza was at that time under bombardment, and she urged her husband to run with her to come to Ahli Arab Hospital. He said, "Why Ahli Arab Hospital?" She said, "That place is a refuge for me. It is a safe place. I can't feel safe except at Ahli Arab Hospital." And our hospital is a place where people can feel that they are owner of these premises. Believe it or not, it's the only hospital in the Gaza Strip that works without any armed guard at the gate. And all people respect Ahli Arab Hospital regulations that we can't work under any arm or any threat of arm of any person in Gaza. This is by itself, give the patient a feeling of safety inside the border of Ahli Arab Hospital.
Thank you, Suhaila. That's wonderful, and it's true. It is when those big iron gates open up, there are no armed guards there. people come and go freely. Suhaila, can you talk about how the living conditions in Gaza for most people impact children's and adults' health and the challenges that presents for Ahli Hospital?
Actually, since Hamas took over the government in 2007, as a punishment for the democracy, people in Gaza, it seems that they have elected the wrong party from the eyes of Western countries. Since then, Gaza is become under complete siege. And where there is no free of movement, people are unable to go out or to come into Gaza. Goods also, it's very difficult to come in or to go out from Gaza except with special permission from the Israeli. This situation really continued up till today. Bearing in mind that since 2007 and up till today, Gaza went through 3 wars where these wars have destructed the infrastructure of Gaza, the economy of Gaza, and not only that, but all sorts of life that let people who are living in Gaza that they are free within their strip. As a result of these wars, not only thousands of people were injured, or thousands of houses destructed, many hundreds were killed. And as a result, still people in need of further treatment within Gaza hospitals. The wars and the siege have really affected the people, as you have mentioned. Unemployment rate today become 54% among the working force. 60 of them are the new graduates or the youth. Of this 60%, other 60% are female. This is, when the working force, nearly half of the working force have no work, and they are in need of small income, at least to keep them survive. Unfortunately, last week, 3 young men committed suicide because they are unable to live this life after they have graduated and they have nothing to feed themselves. This is one of the things that really affecting the life of Gaza. A child of 14 years have witnessed 3 wars. According to UN, 365,000 children are suffering from psychosocial problem. This is, not a joke. A new generation or a young people to live in fear for that for a long time like this, it's really a big problem for the Gaza and in the future of those children. You know, yesterday, a colleague of mine, she came to me and she said her son, who is 10 years of age, he said, "Mom, you are talking about electricity. How the situation was when we had 24-hour electricity." Even children, they didn't know that it is their right to have 24-hour electricity at home. The outages of electricity, it is another burden on the life of people. Nowadays, we have outages varies from 10 to 14 hours a day. And we have at home to rearrange our life according to availability of electricity. So many sufferings in the Gaza, and that reflect bad on the life of people, really. Situation is in deterioration, and I don't know what the coming days will bring, because to keep people oppressed for more than 14 years without any ray of hope, this is a big problem, really.
Thank you, Suhaila. Can you tell us a little bit about the coronavirus and COVID-19 in Gaza, the impact it's had, what the lockdown has been like, and why a COVID-19 outbreak in Gaza would be so dangerous?
Another burden for the Gazan is the COVID-19. Bearing in mind that the health system in Gaza is on the verge of collapsing. Just an idea, the health system in Gaza is suffering from big shortages of medicine and medical supplies. 45% of medicine at the government hospital from the basic list of medicine is at zero balance or at 1 month coverage. Medical supplies is the same. 35% of the list of the consumable is at zero balance. In West Bank, now the problem becomes bigger and bigger. Every day they discovered new cases, about 300 cases in West Bank. It is really a serious issue, and Gaza, with its limited resources, can meet these challenges. Immediately after the declaration of presence of, after they discovered 2 cases in Gaza, all hospitals have been called by Ministry of Health to be a part of the government health government Ministry of Health to combat the spread of the disease. Immediately, Ahli Arab Hospital signed a corona emergency team. Thank God, in Gaza up till today, we have only 72 positive cases, where unfortunately 1 died, 60 recovered, and the rest are still under treatment. That's because of the closure. One benefit of the closure, that it controlled the spread of coronavirus to the Gazans.
Suhaila, can I thank you for that. I think all of us, I know all of us pray that there's not an outbreak of COVID-19 in Gaza. Those of us who have visited and seen the conditions there, the density, the lack of sanitary, facilities,
that's right.
It would be a disaster. So we all hope and pray that it is contained. And I want to move on. One of our guests has asked about the availability of specialized care, especially care for cancer, and what patients do. Patients who can't get the level of care, the kind of care they need in Gaza, what are their options? Can they get care outside of the country, and how likely is it to happen?
Indeed, cancer patients in Gaza, they are suffering most. I have mentioned that government is lacking the 45% of the medicine. Among those medicines that are lacking is the chemotherapy for the treatment of the cancer patients. The trip of the treatment of the cancer patients really is very long and very painful, because with the limited resources of the medical care in Gaza, we cannot cover what cancer patient is in need. 2,100,000 people, they don't have a radiation therapy machine. And to get treatment, they are in need to be referred to West Bank or to Jerusalem, in particular to Augusta, Victoria. To get a permission, it's a long trip, because this permission has to be issued by Israeli government. And not only that, and this referred patient needs a financial coverage, and that should be covered by Ministry of Health in Ramallah. So many patients lost their lives waiting for this permission to go and have treatment in West Bank. It is therefore Ahli Arab Hospital, really is thinking to help those people. Every year we have about 2,000 new patients suffering from cancers. There was a story that a baby with leukemia, he was waiting for a permit for 3 months because of Corona. When they issued him this permit, they didn't allow his mother to go with him, 3 years old baby. And they allowed his grandma. The baby was crying all his day and night, calling for him, mom, until somebody from WHO was passing, and when he heard the story, he arranged for the mom to go. Suffering is, can't be described. And if anybody sit with any cancer patient, he will hear something, he can't believe that it happened in Gaza. Bearing in mind that even cancer patients, socially, they are punished. Ladies, if they have a cancer, they try to hide this disease. Otherwise, either her husband will have another wife, and she will be neglected at home, or her daughters will never have, opportunity to get married in the future. It's a big taboo, and it is therefore any efforts to eliminate the suffering of the cancer patients in Gaza is really appreciated.
Thank you. Thanks, Suhaila. I do want to point out, thanks to the generosity of American friends, American donors, Ahli does have one of the few state-of-the-art mammogram machines in Gaza. So they can detect cancer. And I've seen some of the amazing work they do in supporting women with breast cancer who face the prospect of not being able to get the care they need, but also, as Suhaila said, cultural realities that make life incredibly difficult for them. It's heartwarming and it's incredible what they do, but there is a lack of full spectrum care for cancer patients, and it's true. People die waiting to leave Gaza to get care. I want to leave time for more questions from you. Before I do that, I want to throw a question to you. May not be a fair one, Suhaila, but what do you think about the prospects for peace and freedom in Gaza?
Everybody would like to have peace. But if you come and ask Gazans, what do you think about peace? Simply they will say, peace, is this still a word in the dictionary? People of Gaza were very optimistic when Oslo Agreement was signed, and they were looking into a better future. What is the result of Oslo Agreement? More confiscating in land in West Bank, border to segregate two people, siege on Gaza, destruction to Gaza infrastructure and economy, wars against Gaza. I think, a lot should be done if we want to the peace. And lately, the decision of Mr. President Trump to annex 30% of the land in West Bank. That means another disposition for the Palestinians who are, in their land for hundreds of years. And not only that, there will be restriction on the movement. How it would be a state of Palestine if there will be restriction on economy and movement and so on. I am afraid that this annexation will create another waves of violence and war. And I am really scared because Gaza will be the first victim of this brutal war. If there is a will, there is a way. And I think we have to go back to the Geneva Convention #4. And both people, the Israeli and the Palestinians, they have the right to live in their land with full dignity. And if it comes to me, I will demolish all borders, and I will start building bridges. It is the only way that how can we solve this issue. It needs also the will of the international family and to give that chance to the people. It is not a unilateral agreement. You know, Palestinians should be involved. What they need is a round table to put the leaders of Palestine and the leaders of Israel together and let them find solution to this problem.
Thank you. Thank you. One of the questions here is, how does Hamas view Ahli Hospital? Do they see it as a rival? Are they glad you're taking care of people that they can't handle? What does Hamas think of Ahli Hospital?
Actually, because Ahli Arab Hospital is in neutral, and because we are at the same foot distance between all factions, there is a respect to Ahli Arab Hospital mission of healing. And they know very much we have no self-interest except saving lives of people and helping them to have a decent life in the Gaza. John, we are treating more than 42,000 outpatients per year. And this is, you know, not a joke. We really carry some of the responsibility of the government and help the people to be healthy in the Gaza.
Thank you. Another political question, if you're okay with that. How does the discord, the feud between the Palestinian Authority and Hamas impact everyday Gazans?
Actually, this is another heart aching, that the split of the two governments, really that it has a negative impact on the daily life of people. You know, we are, this differences really has delayed so many things. If I will focus on health, for example, you know, sometimes we lack of medical supplies because there is no funds available within the AP in West Bank. You know, the cut off of the salaries for the government employees. And even during the time of Corona, for 2 months, nothing have been paid for the employees. And that also has its bad impact on the population. You know, the dispute between brothers is more harmful than if it is between one and neighbor. I think it is about the time that there should be a meeting, and they have to be together, because Palestinians are not only belong to Hamas or belong to Fatah. Palestinians are belonging to many other factions, and we have to respect all with all their differences. And this is really a call. There is a good news that today we have heard that there is some sort of agreement between Hamas and Fatah and Hamas offered to send some doctor from Gaza to go and help in West Bank to combat the disease there, the coronavirus there.
Gazan doctors are going to the West Bank
Yes,
to help?
that's what I have heard today, that Hamas offered doctors from Gaza to go and to treat COVID-19 patients in West Bank. Hopefully, it's a step forward for reconciliation.
Great, thank you. So we're just about at the end of our time, and I want to be respectful of everybody's time, especially Suhaila. It's 8 o'clock there in Gaza.
Okay. It's okay.
So Suhaila, I'm going to give you the last word. If there's anything you'd like to say to your friends here in the United States.
Really, I am very grateful to all of you, to all your support to Ahli and to the children of Gaza. You know, your support means a lot to us. Do you know that everybody at the hospital know that there will be a meeting between Suhaila and John and, you know, all our partners in this mission? And they said, oh, Suhaila, we are not left alone. And this is, you know, your support really means a lot to everybody here. We feel we are one body in Jesus Christ, and we are partners in saving the life of many who are in need, and we build a peace. Ahli Arab Hospital is a place of tolerance, a place of love, a place of reconciliation on behalf of those you all participate in helping them. I say thank you, God bless you, and I am waiting for the time to come and see you all in person at Ahli Arab Hospital.
Thanks, Suhaila, and assure you that we are doing all we can to make certain that you and Gaza are not forgotten.
Thank you.
We keep you in our hearts, and we do all we can to raise you up in the incredible work you do to everyone who we encounter. So thank you, thank you. Thank you all for joining us. It's great to see all your faces, and we hope you can join us for our next live chat from the Holy Land. Thank you all, and be well.
Thank you. Thank you.